Welcome to Independent Lifestyles, a program of the Sheboygan County Aging and Disability Resource Center. We present topics that promote independence and direct viewers to resources that will help maintain their independence in our community. I'm Kristin Stearns, an outreach worker at the ADRC and the host for the show today. Our special guest is Kristin Stearns. She is the CEO of Lakeshore Community Health. Good morning, Kristin.
Good morning, Christine.
How are you?
I am wonderful and happy to be here today.
Good, it's the first day of fall.
It is the first day of fall.
Know.
I'm wearing pink, however.
You look wonderful.
I still want it to be summer.
Yeah, it's great. Tell us a little bit about yourself before we go into questions.
Wonderful, I can do that. So I am a resident here of Sheboygan County. I actually grew up here, left to go to college. I have a master's degree in social work administration, public policy, and community organization and planning. And I ended up back in this community about 1998. And started my career in nonprofit social service management at Catholic Charities, and moved on to Sheboygan County Interfaith and now to Lakeshore Community Health Care.
Wonderful, wonderful. So you're from Lakeshore Community Health, and when was the start of this?
Yeah, so we have an interesting start, Christine. We started our services in June of 2012, but I'd like to back up a little bit. This came out of a community needs assessment, and so back in 2006, Aurora, now Advocate Aurora, and St. Nick and Perea, as well as the United Way and Public Health, got together to do community health needs assessment. And the number one need back in 2006 was access to oral health care, with medical and mental health as second and third. And so a group of us got together to really try to figure out what we could do to create long-term impact regarding those access issues. And so so it took us 4 years to plan, and to work with some outside consultants to then finally decide to become a nonprofit organization, write for what we call a new access point grant with the federal government. And in December of 2010, we submitted our grant. In June of 2012, we got notice that we were awarded that grant, which is from the federal government, from the Department of Health and Human Services, through a little granting process called the 330 grant out of Public Health. And that initial grant funding for any new access point is $653,000, which this community was able to receive. And that's really to support the uninsured population that part of what we focus on. So we were really excited to have that, and had to then start right away with building a community health center.
Wonderful. And what is your mission statement?
Yeah, so that plays into our mission, doesn't it? So our mission really is to provide comprehensive medical, dental, and behavioral health care by eliminating barriers through language, finance, transportation, and to do this regardless of a person's ability to pay. So
Nice,
that's our mission.
Great. And could you tell our audience where you're located?
Yeah, so about 3 years ago, we purchased the former American Orthodontics building on 17th and Seaman Avenue. Our address is 1721 Seaman Avenue. And so we started the build out, and we opened our last part of our building, a 20,000 square foot building, in October of 2017. And I have to tell you that it was a $7.2 million project, and 6.2 of that was donated from our local community to help us build, which is amazing.
That is amazing. Yeah. That is. And could you tell our audience as well the different types of services that you are providing?
Yes, so again, we have to provide so I'm just going to talk a little bit about being a federally qualified health center, which is the title of what we are. And we have to provide 3 core services: primary medical care, oral health or dental care, and behavioral health care. So I'm going to start with those, and then I'm going to tell you all the other services that we provide in addition. So why don't we start with oral health care? So we provide dental care. We do it full restorative dentistry, just like you would get at your dental office. So from cleanings to fillings to root canals, we do partials and dentures. The only thing that we don't do at Lakeshore Community Health Care is what we consider cosmetic dentistry. So we don't do teeth whitening, we don't do implants, and we don't do braces or orthodontic work.
Yes.
But everything else we cover there, and I have to tell you, especially with the population that we're talking with today, is we do have an ADA accessible dental laboratory, so somebody who's wheelchair bound can actually get services at our clinic without having to get into a dental chair.
How wonderful.
Which we're very excited about. Here in Sheboygan, we have 7 full-time dentists, 6 full-time hygienists, and 20-some amazing dental assistants that make up our clinic. And all of our employees are hired by us and are paid, so we don't use volunteer staff at this point in time. I'll go over to our medical clinic. We provide primary health care, just like you would get at your primary health care doctor. So again, you get your physicals and checkups, chronic disease management. So we work with our diabetic population, hypertensive population. We do women's health. We do pediatric health. We take care of birth through death, all ages. We do have a medical doctor on staff and 3 nurse practitioners that make up our team in the medical department. Then we also have our behavioral health, or what I call outpatient mental health therapy. And we do therapy a little bit different. So we actually part of our clinic is that we actually place a therapist right into our medical practice, and so they work right alongside our doctors and nurse practitioners. And if somebody is struggling with any mental health issues, or maybe some behavioral health issues like behavioral modification, behavioral change, things like insomnia, our behavioral health therapists can actually join the physician or nurse practitioner right in the exam room. They'll leave, and the therapist will do some brief intervention with our patients. It works out really well, especially with the stigma piece of it. And so that makes up our 3 services. We also have chiropractic, pharmacy. We have social work case managers and RN case managers that then, and of course our medical assistants that finish up our team.
So this has grown throughout the years.
It has grown. We have a clinic in Manitowoc also, and between both clinics, we now have 110 staff.
How wonderful.
It is. Christine, I can remember the day of having 25 staff members working out of very small clinics, so this has been really great for us.
Yeah, good. And do you serve the whole community or specified population?
Yeah, so we do serve the whole community. But we really focus on making sure those that have barriers to care are getting services. So we talk a lot about our under and uninsured, maybe folks with multiple issues. We really want to focus on that group because they sometimes struggle to get care. They're utilizing our emergency rooms or urgent cares, and they don't really have a medical home, which is what we're trying to provide. But we are a community health center. So anybody from the community can come and receive services through us.
Great. That's great to know. And what type of payment is accepted when utilizing your services?
Yeah, so we accept all types of payment. We accept Medicaid, Medicare, private insurance, and then those folks that fall at or below 200% of the federal poverty level, we're able to give them discounted care. So the federal government has 98 program requirements that we have to abide by to continue with our grant. And one of those requirements is that anybody who is at or below 100% of the federal poverty level, we have to provide them a nominal fee. And our board of directors, who are made up of users of our clinic, so our board of directors, we have almost 78% users of our clinic are making up our board. They make the decision on what that nominal fee is. Ours is $25 for a medical or dental appointment, and then it is $15 for mental health and chiropractic. And so that's the nominal fee. And then we have a sliding fee scale from 101% of the federal poverty level up to 200%. And it goes anywhere from $30 to $70 to receive care. And we work with everybody. Again, if you heard that little line in our mission statement, the last piece was that we provide care regardless of a person's ability to pay. So we have to serve everybody in the community, no matter what their income status is.
So if they have nothing and they come in, your goal is to still help them.
Absolutely.
Does that happen in our community?
It sure does, more than I think people think.
I think so.
Absolutely. So we'll help them try to get on insurance. I have staff that help try to get them on Medicaid or Medicare, as well as the Affordable Care Act, Obamacare, Marketplace, whatever you want to call it. We have a staff person that can help assist in that. And so we want to get people insured. It's really important, especially if they have chronic diseases and we need to refer them out to a specialist. Mm-hmm. But we want to make sure that people can afford our services.
Good. How many patients have you served in the Sheboygan County area?
Yeah, so that's a great question. We have served over 9,000 unique patients here in Sheboygan County.
9,000?
9,000. And we have capacity to serve a lot more. So our doors are open and we're ready to serve people. One of the things I didn't talk about when we talked about all of our programs is that we do have school-based programs that we're doing also. So some of those are kids in our schools that we're serving with dental and behavioral health. So, but 9,000 folks were served last year.
Nice. And is there more of one than the other?
Yeah, our dental is definitely the majority of those patients. Access to dental care in our community, even though we have phenomenal dentists that do a lot of great work, there's still access issues, so we're able to help meet that need.
Nice, nice. There's such a big need in our community. How do you manage no-shows or late arrivals?
Yeah. So we do a couple of different things regarding no-shows. So again, our clinic is a little unique compared to other clinics and dental offices in the world. We have a policy that when you schedule an appointment, we call you 48 hours before that appointment. We ask you to call back and confirm that you're going to be at your appointment by 1 o'clock on the day prior to your appointment. So if your appointment is on a Tuesday, you'll be called on Friday. If we don't hear from you by Monday, we're going to call you Monday morning anyways, and ask that you call us back by 1 o'clock on Monday afternoon. If you don't call us back, we just take you out of the schedule, and it's not considered a no-show, and we fill that slot in the schedule with somebody else who's been waiting to get seen. So that's how we really reduce our no-show rate. We have about a 10% no-show rate because of that. If you do no-show the first time, we just give you a little phone call and remind you that it's really important that you you come to your appointment. If you no-show 2 times, you'll get a letter and a phone call from us reminding you of our policy, which is that after 3 no-shows, you will be put on restricted status, which just means that you can't schedule an appointment with us, but you can walk in at any time and get triaged and see a provider. But because we have so much need in our community, we really need to, again, we're providing access to care. And one of those barriers is people not showing up for appointments, because if somebody doesn't show up, I can't, and it's last minute, I can't fill that slot up. So that's really important to us. So the no-shows you asked about, and you asked about, late arrivals. Yes.
Correct.
So we have, if you arrive late and it's within a 10-minute framework, we're going to see you. If you arrive after that, one of our nurses or dental assistants is going to come out and triage the situation. They're going to see if you actually need to be seen that day. If you do, we'll get you in. Probably not for everything that you were wanting, but a little something. To at least deal with whatever that urgent need is. If it's not an urgent need, we'll just reschedule the appointment. Part of that is so that we don't run behind, again, working with a population that sometimes struggles to get places with transportation as a barrier. People have rides, and they, we want to be conscious of everybody within the clinic and what they need.
So it sounds like a good way to communicate, so it works out.
Yeah, it really does.
So when you have these people, because I'm familiar with people in the community as well that doesn't have transportation sometimes to get out by us.
Right.
What do you offer or suggest, or the resources that you have them utilize? If they don't have any money, of course, we know that there isn't going to be any money to write a bus. So where do you play in that?
Yeah, so if they're on Medicaid or Medicare, they can use our medical transportation program, and so that's our the first point of access for us. If they're uninsured and they live where there's a bus route, we have a grant through the City Development Block Grant, so if they're in the city of Sheboygan, I'm able to give them bus tokens. We then purchase outside of that extra bus tokens, so if they live, again, outside of the city, we're still able to give them bus tokens to get into their appointment. And then we work with other programs like the ADRC to help us. If all else fails, then we can call you guys up and sometimes get some assistance with that.
Right. Is there ever been a time when you needed to turn people away?
Yeah, so we've never turned people away, but we have had waiting lists. So we've been able to utilize waiting lists and those no-show appointments to get people in when needed. Before we opened up the clinic on 17th Street in Saman, we had a 1,000-person waiting list.
I remember.
Yep. Today we run about 150 people kind of always on the waiting list for us.
So that's gone down considerably.
It really has. It really has.
Good.
Yeah.
The program sounds awesome. And I can remember when you first were in the community on North A Street.
Yep.
And I can remember when I went in there and I thought, it was so busy and it was so tiny and... and now when I went in there this last time, I was so impressed because it's beautiful. It's beautiful, and there's a lot of care there. I can see that with people that I've met, and I hear good things. Yeah,
we have an amazing staff who really believe in our mission and want to make people healthy and eliminate those barriers, which is really helpful to us. We've created a building that is provides dignity and respect for our patients. It is state of the art. It's a phenomenal building. If people haven't been there, we're always willing to have you come in and see what we're doing and welcome that. We're really excited that we're here in Sheboygan County and how supportive everybody's been with us.
What are the future plans are there for Lakeshore Community Health?
Yeah, so we've grown so much over the last couple of years, and growth is still in our future. So again, last year we added chiropractic. I talked a little bit about that we have a similar clinic up in Manitowoc, and we're looking at starting a substance use treatment and recovery program up there late this fall, early winter. Really focusing on the wide, full range of recovery from from therapy to group therapy, and then we will also be providing medication-assisted treatment, which really focuses on those folks that are addicted to opioids and alcohol. We use medication in some cases to really help work with those folks. And so we're excited to get that up and running. We're going to say we're growing slowly with that. So we're inviting our patients of the clinic first, and then we'll open up our doors to the rest of the community. But my guess is that if that's successful up there, we'll see something like that maybe down here in Sheboygan in the future.
And it's all outpatient, correct?
It is all outpatient, absolutely. We have everything we do is outpatient. We're still a primary care clinic. That's what we do. And then I am really excited to say that with a couple of amazing donors, we are going to pilot a school-based program here in Sheboygan County starting hopefully, fingers crossed, I say, in January. We're looking at opening what will be called the Longfellow Family Clinic at Longfellow School here in the city of Sheboygan, really focusing on the families of the students that are being served at Longfellow. And so we're thrilled about that. It's a pilot. We want to see if it's going to work in this community. It's definitely successful in communities across the country. As there's about 1,200 community health centers across the country, over 10,000 sites, and a lot of them are doing school-based healthcare, and so we're gonna test it out also.
So you may have said it in your conversation, but I just want to make sure. Now, will that clinic be held at Lakeshore, at Longfellow?
Yep, it will. It's going to be an on-site clinic at Longfellow School serving the children and families of the Longfellow students.
That's really nice.
Yeah, we want to see if this is going to work. Again, we know that workplace wellness is really important. We know that these on-site clinics in the workplace have really worked. We also know that transportation is a barrier to care, which is why our school-based dental is so popular, as well as our school therapy through the PATH program. So I think, this is another opportunity for us to see if this is going to work within our community, again, through some generous donors who also believe that this could help eliminate some barriers, get kids healthy, parents to work, and kids in school, which is really important to us.
Would it be possible if you could just tell us one of the success stories or something that makes it all worth it?
Oh, I can't. I have thousands of success stories. So let me think for a second and go back. So maybe I'll do one from our dental side.
That would be great.
And then maybe I'll do one from medical behavioral health. So when we first opened our doors, I can remember walking into the clinic on A Street, and I was not the CEO then. I was a board member at that point in time. And I ran into a dentist who looked at me and just really sad. And I asked her, what's happening? And she said, I just had to pull every tooth out of a 16-year-old child's mouth. Right? So again, later on, a couple weeks later, a month later, so I ran into her and asked her about the young man, and she said, oh my goodness, he got a full set of dentures and was just beaming. Now, our hope, of course, by being in the schools is that we won't be pulling teeth like that anymore. But the fact of the matter is this young man now is able to eat and smile and hopefully be successful in the future.
It's very important because your smile says a lot about you.
It does, it definitely does. So that's huge. On the medical behavioral health end, we have a board member who who talks about not being insured. She actually ended up being a caregiver for her parents, and so was quit her job and chose not to be insured. Wasn't paying attention to her own health. Took care of her aging parents through their end of life, and ended up in our clinic, not feeling well, feeling exhausted, having some anxiety issues, depression. I think everything that happened. Came in, saw one of our doctors. They took her blood sugar and it beeped, right? So on the blood sugar scale, if it beeps, it means it's bad. And so it beeped. We got her into the hospital. Again, our partnerships with our hospital provides discounted care all the way through. She was so worried about it, didn't have a bill at the end, got her diabetes in order, saw our therapist to deal with her mental health issues, and she now is healthy and happy, has a job, is able to function, and now serves on our board of directors. So it's
Awesome.
Amazing. Yeah.
It's awesome. It's so nice when you have people that actually lived it, walked the walk, because I think that means more to people
Yeah.
when you listen to them speak,
Right.
because they're actually talking from experience,
Yeah.
and that's the most important thing.
Yeah. She'll say that without Lakeshore, she would not be here today. And that's a huge thing,
That's
right?
an awesome
Yeah.
thing.
Yeah.
That's an awesome thing. So,
I just want to say thank you.
no problem.
This has been really fun.
I did. I enjoyed interviewing you.
I'm glad I got to come back on the show. It's been a while, so I'm glad we got to talk about more things that we're doing. I just have to say thank you to the ADRC, because you guys have been huge supports of Lakeshore also. And
Well,
we
we're so
appreciate
happy
it.
to have you guys,
Yeah.
because we have now somewhere to point somebody
Yeah.
somewhere, instead of saying, none of the dentists take the Medicare card. You know
Right.
what I mean?
Right.
Or the MA card, yeah.
Yeah, so we're really, really glad to be in the community and be here with you. So thank you
Well, thank
for
you.
everything you do for us.
Thank you. I would like to thank Kristin for sharing with us how important it is to help one another. And to our audience, thank you for tuning into our show. Please join us next month on Independent Lifestyles for another interesting topic on maintaining your health and independence. Be well.